In Wuhan, the local health commission ordered the city's hospitals to report any new cases directly to them and barred them from releasing information to the public. Within 12 minutes, the orders were leaked online. They too went viral. News of an outbreak had escaped.
I guess you could say it's the most wonderful and busiest time of year. A lot of people, high volume, are going to be traveling.
That night, the rumours reached Marjorie Pollock, an epidemiologist with ProMed, an organisation which sends out alerts on disease outbreaks.
I checked my email after dinner, and I had an email from a colleague in Taiwan. Social media was ripe with lots of chatter going on in Chinese of an outbreak, and did we know anything about it? I was able to monitor the Weibo posts, and it was just going wild. My reaction was, we're in trouble. It was very much a deja vu of what happened with SARS-1. So put together a report to go out as what we would call an emergency post, getting it out as soon as possible.
It went out to around 80,000 subscribers worldwide.
It's already the new year in much of the world, and here in New York, they're getting ready for the most famous New Year's spectacle, the ball drop in Times Square. NBC's Stephanie Goss.
Peter Daszak, head of a New York-based infectious disease research organisation, contacted Marjorie Pollock with more news.
I got hold of her on New Year's Eve, and as the champagne was getting warm, we realised something really serious was going on in China. We had it from a good source that this was a coronavirus and that it was 20% different to SARS. So we knew that SARS was pretty good at transmitting from person to person. We knew it had a 10% mortality rate. That's a huge red flag. And really knew something was wrong when every single senior person that I was trying to get hold of in China was busy. I sent a really long text to George Gao, head of the CDC. I offered to send a team out there to come out there and do anything to support him. And I got the shortest response ever from George, which was, Happy New Year.
But George Gao did contact virologist Ian Lipkin with information. This is the first time Lipkin has recounted details of their conversation.
I was in a restaurant waiting to ring in the new year, and I got a call on WeChat, and it was George Gao. He'd identified the virus, it was a new coronavirus, and that it was not highly transmissible. Well, this didn't really resonate with me because I'd heard about many, many people who'd been infected. I think he was just wrong. You know, I don't think he was duplicitous. I think he was just wrong. He should have released some sequences and said, this is what we know. These are the sequences we have. My view is that you get it out. That's the way we do it, because this is too important to hesitate.
news of the possible outbreak, the return of SARS, had actually spread far beyond Wuhan by late December. And that suddenly there was this increasing kind of pressure because the outside world was looking. But that's a dual-edged sword in China. Because on the one hand, the outside world looking can create pressure to act. The outside world looking can also create pressure to cover up.
Viral pneumonia has hit central China's Wuhan city. Authorities have reported 27 cases in total, 7 of which are critical.
The National Health Commission now ordered Wuhan officials to announce the outbreak. The news was aired on state-run TV.
Patients are reported to have worked at a local seafood market.
But the officials played it down, describing it only as a viral pneumonia.
因为我们肯定会，我们排查了嘛，排查了目前是跟非典没有关系，别的病原体正在排查。
They reassured the public that there was no evidence of human-to-human transmission and closed the market in which they maintained many cases originated.
The first instinct of the authorities is always to cover up. One of the key values of the Chinese Communist Party for the last 40-odd years has been stability. The avoidance of what they see as chaos, the dangers of revolution, overthrow. But the party is also very concerned about the idea that whole populations might freak out. And that might result in mass shortages or people being crushed to death trying to flee somewhere. That urge to control, that belief that the public can't be trusted, is also very kind of ingrained.
Definition of stability keeps getting escalated as the ability of the Chinese government to monitor absolutely everything improves. Even some of the thoughts and speeches of Chinese citizens, they are now seen as signs of instability. Increasingly, even in WeChat, which is a private platform, that kind of, so-called deviant speech would be punished with administrative detention or suspension of accounts.
On January the 1st, the Wuhan police dealt with the doctors who'd spread the news of an outbreak. On state TV, they were labelled rumour mongers and internet users. Several were given official reprimands by the police. The news was widely covered on national television. The eye doctor, Li Wenliang, whose post had gone viral, was among those to sign a confession. The clampdown extended beyond doctors. Chinese journalists were now subject to specific censorship instructions, and key words began to disappear from the internet.
When I first started seeing the reports on December 31st, doctors from inside were describing it as SARS. And so, I started searching Wuhan SARS to see what the discussion was online. And I couldn't find anything. relevant search terms blocked, which is not a surprise because the government obviously wants to keep things stable. I'm pretty sure they did not want any comparison to SARS. They wouldn't want a panic to ensue because of that.
But in Beijing and Wuhan, top government officials were now confronting evidence that they were dealing with something potentially serious, a novel coronavirus.
So let me tell you what international law requires. If the government knows about a novel infection that meets the criteria within the international health regulations, and a novel coronavirus, by definition, meets those criteria of a potential public health emergency of international concern, the government is obliged by law to report that to the World Health Organization within 24 hours. So it was reportable. The failure to report clearly was a violation of the international health regulations.
The World Health Organization first learned about the outbreak, not from the Chinese government, but from social media and the ProMed Post. On January the 1st, its incident management team began a series of conference calls.
I remember sitting on the floor in the living room of my sister's house at 3 o'clock in the morning on those calls with the aim of, really understanding the situation. We had the assumption initially that this may be something new, that it may be a new coronavirus. And as a respiratory pathogen, for us, it wasn't a matter of if, human-to-human transmission was happening. It was, what is the extent of it, and where is that happening?
WHO officials requested more information from China. It was 2 days before they heard back. But what the National Health Commission told them was vague. Only that there were 44 cases of viral pneumonia of unknown cause.
The country has an obligation to answer WHO's questions honestly, fully, and transparently. And I don't think that happened entirely. Once you report to WHO, it's open to the world. You start to get travel and trade restrictions placed upon you. And so I think China's view was that it wanted to handle this pretty much, and that it was going to, it didn't want outside interference.
The National Health Commission now had a team of scientists and officials on the ground in Wuhan, investigating the outbreak. Labs across the country were secretly racing to map the complete genetic sequence of the new virus. One lab was run by a renowned virologist in Shanghai, Professor Zhang Yongzhen.
Professor Zhang, he's a very friendly, passionate, extraordinarily hard-working scientist. I've been working with him since 2012, and we essentially used genomic technology to try to understand virus evolution and diversity. Just how many viruses are there? How big is the total universe of viruses, the virosphere?
Leading virologists Zhang and Holmes were in the middle of a long-term project on respiratory diseases at Wuhan Central Hospital when the outbreak began. On the 2nd of January, lung samples from infected Wuhan patients were sent by high-speed train to Zhang's lab. At 2 a.m. on January the 5th, Zhang obtained the full genetic sequence of the virus.
I was driving to breakfast, and he called me on the car phone. His team had worked very hard, and so he was very proud, obviously, of the work they put in. On that very day, he was working to try and get information released as soon as possible, so the rest of the world could see what it was, and so that we could get diagnostics going.
It was important confirmation that the virus was very similar to SARS, and therefore likely transmissible between humans. That day, Zhang's office wrote to the National Health Commission, advising preventative measures in public places. He wanted to make the sequence public right away, but couldn't.
There was an official memorandum that had gone through saying that we were not allowed to do this, and so he was put in quite a difficult position.
2 days earlier, the National Health Commission had sent out secret instructions to laboratories, forbidding them from publishing their results without authorization and requiring them to destroy or hand over their samples. The Health Commission's orders were later leaked. 4 other Chinese labs also obtained the full genetic sequence of the virus. They too were forced to sit on their findings.
That notice effectively silenced individual scientists and laboratories from talking about this outbreak, from revealing information about this virus, and potentially allowing word of it to leak out to the outside world and alarm people.